It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox back with another edition of the Best Docs Network, featuring some of the best procedures and, of course, doctors in the Houston area that help change people's lives, like our first best doctor, Dr. Evan Feldman.
October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history, she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through, some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander and implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club, and so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my response is, I mean, they want to know how I did it, and I'm very open about how I did it. I was like, you know, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
Cynthia wanted to lose body fat in certain areas to get ready for her big wedding date, and she did that with the help of Dr. Lucien Ravella. To find out more about Cynthia's story and other life-changing stories, log on to bestdocsnetwork.com.
My name is Rashid Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico, went on to medical school at Loyola University. I did a combined degree program. I did an MD and a PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency and hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long, long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
We have an epidemic of diabetes going on in America at this time. Diabetes is high blood sugar. Normally, your blood sugar should be less than 100. We define diabetes as a blood sugar of 126 or higher. If you have a blood sugar of 100 to 125, that's called pre-diabetes. If you don't do something about it at that point, it will develop into diabetes almost for sure. What's bad about having diabetes? Well, it damages every blood vessel in your body. That can result in vision problems, even blindness. It can cause kidney failure and heart attacks or strokes. None of those are good things. To prevent or treat diabetes, the best thing you can do is lose weight. That will help the most. Also, eating an ADA, that's an American Diabetes Association diet, will help. You can find that on the internet at multiple websites. So if you have high blood sugar, exercise, eat right, and things should get better. Remember, sugar is sweet, but you don't want to be too sweet.
Graham was swimming in a banana boat with two other people. Two of them fell off the banana boat, and Graham sustained a fracture of his cheekbone when someone's knee struck him in the cheek.
He immediately could tell that something was the matter, and luckily he's an orthopedic surgeon, so he pulled me out, felt my cheekbone, and he's like, "You have a broken zygomatic complex." I'm like, okay. So I really don't know what a broken zygomatic complex means, but I know that if it doesn't feel right and when I put my hand on my cheek, there's no cheekbone anymore. If I got it taken care of within 7 days, then it shouldn't be an issue of where it got taken care of. And he recommended that instead of getting it taken care of out in the middle of nowhere, 3 hours north of Atlanta on the weekend, that maybe I should wait to come to Houston and find a doctor who's good and make sure they'll have more time. It's not that pressing.
He saw me with a depressed cheekbone, some double vision and numbness of the cheek, and there was a palpable and visible deformity. He had a significant number of injuries and fractures, and he had no support to the floor of his orbit. So with time, if that's not corrected, the eyeball will drop, he'll have increased double vision, and he will have continued numbness of the cheek. Now the fracture was right through the opening. There's a foramen or opening in the cheekbone where the nerve supplies sensation to the teeth and the upper lip and the cheek, and the fracture went right through that area. Often by reducing the fracture and placing the bones where they ought to be, there's less compression on the nerve, and the nerve regenerates, and there's nearly normal sensation afterwards. But that's about the only residual that he has really right now.
So apparently if I caught the knee a little bit closer to my nose, I could have died. And if I didn't get the surgery, then I probably wouldn't have an eye, because since there's no bone holding it in place, it would have just sunk into my face, and that would have caused a whole bunch of damage to the eye to the point where I couldn't use it. So I think having a second eye is pretty awesome. I like that, and the fact that you really can't tell is pretty unexpected bonus for me. I was kind of just thinking, oh, cool, I'm gonna look like some weird, gruesome Frankenstein Quasimodo type situation, and you really can't tell the difference.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
For more information on any of the doctors you've seen on today's program, as well as some of those outstanding procedures, head to the website bestdocsnetwork.com. Right now, it is time to head to our next doctor, Dr. James Ludwick, ear, nose, and throat doctor that also specializes in sleep disorders.
Jill came to see me for hearing loss. And then while she was here, she was also talking about, she told me she had some allergy problems, and then also the snoring, and it was feeling like she had insomnia, and she couldn't stay asleep during the night. She was tired during the day, wake up with a dry mouth.
I think you have sleep apnea. I'm going, oh, what's sleep apnea? He said, well, sleep apnea is where you don't get any REM sleep and you don't sleep well. Are you tired a lot? I said, I've always been tired.
we obtained the sleep study and found out that she had, you know, a lot of sleep fragmentation from snoring and from sleep apnea.
He said, well, we'd like to do the second test, of course. We diagnosed the fact that you do have a sleep apnea. So went in another night, electrodes, but I had a mask this time. And I fell asleep. I woke up the next morning. It was like, wow! I mean, geez, it was like, I am so rested. So he didn't have to do a hard sell or anything with me. I mean, he said, you need a BiPAP machine. We've decided that, and this is why. And he sat down and explained everything to me.
If you have the other effective treatment option, and you decide to have surgery, and there's something that I think that we're gonna do that has a good chance of making you better, then let's do it. But for some people, it's just not their best interest, you know? And she's happy, you know? Jill sleeps every night, has no complaints, she loves it, it's safe, it's effective, guaranteed to work. Are we gonna beat that with a surgery? No, we're not.
My coworkers at the time noticed an immediate difference between, I mean, I didn't tell them what was going on, but they noticed an immediate difference in my demeanor and my approachability.
If that therapy makes you feel great, I just think that your opinion of that therapy is gonna change, right? Now, if you can't use it, you know, you're claustrophobic, and you have an obvious anatomic problem, and sure, let's go down this other path and we'll make you better. But better and perfect aren't the same, you know?
It's made a great impact. It's really, the only thing I miss, and this is gonna sound crazy, but I'm used to having 22 hours in a day as opposed to 16 or 17, you know? And I can't get as much done as I used to get done because I'm sleeping. But the trade-off is great.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
I had 2 children, and I nursed them both, and my breasts were completely saggy and gone.
Aisha came to me after she had 2 children. She was interested in improving the appearance of her breast after breastfeeding and childbearing. They had lost some of the fullness, and that typically happens after giving birth.
I simply wanted to go back to the way I looked before I had children. I didn't want to look unnatural in any way, and he completely understood that, and he had a very good understanding of what both me and my husband wanted.
That's the most common question, is can they get that body back after children? They may not necessarily get that exact body, but we certainly can remove the extra skin, tighten up their waist, and give them that figure back that they had before.
The procedure went very well, and the recovery time was easier than I thought. I mean, I thought the tummy tuck, which I almost didn't want to do in the beginning, and I ended up doing, which I'm very happy with, was actually much easier than the breast augmentation. I was probably in bed for about 5 days, and then not really back to myself for about 2 weeks. But 4 to 6 weeks after that, I was completely fine, like nothing had happened. I felt great.
Typically, after having children, women have extra skin and some fat along their tummy as well as on their hips. And this is, even with all the exercising, many people can't lose that weight. And so if they've completed their childbearing, that's the perfect candidate. With the breast, many times again, there's postpartum involution of the breast. So many times again, after childbearing, they can't reverse this effect. And again, that's a good candidate.
He was very, very nice. He was very applicable to my needs. You know, he talked both to me and my husband about what kind of results I wanted.
Someone who, like herself, who's very fit and wanted to enhance the appearance of her breast after childbearing, this was a perfect case for her.
And he was so professional and so nice. It was fantastic, fantastic experience.
The typical type of patients that we see here are people who suffer from a significant amount of headaches. Not necessarily all migraines, but headaches of every different type. And what we try to do is figure out the generator of where the headaches are coming from and try to treat them more from the source.
My severe headaches were interfering with my long distance running. I run marathons and half marathons, and I wasn't able to train for those races any longer.
Sometimes when there's a component of a spinal leak or even an increased intracranial pressure, it's very hard to pinpoint over a long amount of time exactly what it is that caused that problem. So in Catherine's case, we couldn't tell if there was a positional component or not because she just suffered from headaches 24 hours a day, 7 days a week.
Dr. Soren really took a holistic approach to identifying what my headaches were and providing a comprehensive treatment plan. So initially he was able to relieve a very severe headache that had lasted 4 or 5 days by performing trigger point injections, which helped immediately relieve the tension and the pain that I was experiencing.
There's so much data now that has to do with migraine and increased risk factor for stroke. So if you have a patient who has a long-standing history of migraine headaches, we definitely want to get an image of their brain.
He's kind of empowered me to help manage the headaches on my own, and then I know that I can always go to him if I'm having an emergency situation and there's a headache that I can't knock out with the oral medication that he's given me to help treat it.
Based on her clinical symptoms, we devised that she had a low-pressure headache, and so what we did was we performed something called an empiric blood patch. And so what that means is that we will take sterile blood from her hand and knock her out, and instead of doing an epidural steroid injection, we'll actually use her own blood to form a clot over the area where the leak is coming from.
After I saw him, there were radical improvements in my quality of life. I went back to long distance running. I was able to complete 2 marathons under Dr. Soren's care, plus many half marathons.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
A bunion informity is a deviation of the first metatarsal and the second metatarsal. So basically, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an awesome bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then, obviously, for the females, it's wearing the high heels. There's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
Kyle is almost 12 years old, and he actually became a patient here a little over a year ago. But he is a pretty basic, typical boy who developed his allergies about the time he started school.
Well, Kyle plays baseball during spring and fall season. And during spring, his allergies are always acting up. Sneezing, runny nose, coughing, what else? Nosebleeds. So that prompted us to go to an allergy clinic.
He's allergic to the spring trees, the grass in the summer. He's allergic to the weeds in the fall. He's allergic to the mold, but not luckily as much, but animals as well.
Well, at home we give him Singulair every day. Sometimes we give him Zyrtec. But as far as the clinic, they're planning to put him on a testing, like he's going to get some shots every week, every 2 weeks.
So as soon as school is out, we're going to bring him in here and we're going to do what we call a modified rush procedure, or it's also referred to commonly as cluster immunotherapy. And what we're going to do is we're going to give him multiple doses on one day, building him up quickly through the more dilute vials so that he'll start to see benefit sooner.
It will help him a lot. As far as outdoors, I think we can enjoy outdoors more than we do now, especially spring season.
The advantage of doing it with shots versus under the tongue is that the immunotherapy that we do has been proven to be effective in actually reducing the amount of allergy antibody that circulates in the blood, and also raising the amount of protective antibodies in the blood that prevent you from responding in that fashion. And some true immunological changes occur with the allergy shots. I'm pretty sure he's going to respond. He's a real easy, typical, boy that hasn't quite hit teenage, but is going to start suffering in terms of his sports and his dog and everything else that that he would like to do in his life if he doesn't fix the allergy problem.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are 2 sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are 3 major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks, and that's serious. But the most common one that we really address all the time is estrogen, and there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver, and simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating, it's controllable. Maybe that control is the goal, but we're not going to have terminal hot flashes.
All right, that'll wrap up another edition of the Best Docs Network, featuring some of the best doctors as well as procedures in the Houston area that, of course, help change people's lives. You want to see more outstanding video, more outstanding doctors, head to the website. It's bestdocsnetwork.com. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.